India currently has many cases of COVID-19 infections. However, social media platforms such as WhatsApp have led to an increase in sharing negative information about COVID patients. Such false information and attacks are breeding fear and confusion among the citizens. There have been many cases. For example, images of individuals displaying symptoms but who are not COVID positive are going viral. Families suspected of being COVID positive are being assaulted. Doctors, nurses who are doing a fabulous job are being stigmatized due to COVID-19. If we discriminate against medical workers, how will we contain COVID-19? There have been many cases like this. Many hearing individuals are sharing WhatsApp messages falsely targeting people of being COVID positive. They do this out of excitement to share negative information. This is not a joke. COVID-19 is not a joke. Many such cases have happened in the deaf community as well. Here are two examples. A deaf person was not feeling well and was not sure about his sickness. He went to the doctor for treatment where he was made to wear a PPE suit and was very sick. Someone got to know about this and video called the deaf person. The deaf person's video call conversation was recorded. When the person asked the deaf person what happened, the deaf person said he was feeling sick. The person said that since the deaf man was displaying all the symptoms, he is COVID positive. The recorded video call was then made viral. How do you think the deaf person must have felt? The person was bombarded by calls. Turned out, the person did not have the coronavirus. The deaf person misunderstood his symptoms, which were due to a change in weather. When the person went to the doctor said there was no need to visit the clinic. The symptoms were due to climate change. This recorded video labeled him a COVID positive patient. The deaf person was unable to understand. Is recording a video like that and making it viral right? Is this a joke? It's completely wrong. Second case is of a deaf family who decided to stay at home as a precautionary measure. A deaf man had an itch in his throat and asked for hot water. When he asked for hot water, his family said this meant he has coronavirus. Labeling someone like that is not a joke. There are many cases like that happening all over India. In the deaf and hearing community, this is not the right time to spread false information, jokes, and oppress people during the COVID outbreak. We need to be united and share positive talks from now. Now let me tell you the Ministry of Health Family Welfare's issued certain points we must all follow. Remember, Prime Minister Modi had said that medical workers are like God. They are helping to contain COVID-19 and hence Prime Minister Modi said we must respect them like gods. However, people are discriminating and assaulting doctors. If targeted like this, medical professionals will lose their morale. And this will lead to a rise in infections. This is why we must cheer them on their efforts, which will motivate healthcare workers to help contain COVID-19. Remember, the government is providing them with PPE suits so that they can care for us and stop the infections. You can verify the authenticity of information in two places. First is the Indian government's website of the Ministry of Health and Family Welfare. They've mentioned all information regarding precautions related to COVID-19. Second is the World Health Organization. Do not trust any information shared on social media. Messages on WhatsApp are quick to go viral. When you receive messages on WhatsApp related to COVID recovery stories, COVID related deaths, etc., if you are confused about the veracity of the message, then do not forward them. Once you confirm its authenticity, you can share it. If you receive messages and know they are false, immediately inform the person about it so that it doesn't go viral and there are no misunderstandings. If you know the news is fake and do not inform the person, it will go viral, spreading fear among people. There is no harm in sharing information on WhatsApp, but remember to share positive stories of those who have recovered from COVID-19. And stories about the hard work of healthcare workers and security officials. Sharing such positive stories will give citizens the strength and remain united. Never spread the names, identities of those affected or their locality on social media. Secondly, taking pictures and sharing the identity of patients being taken by healthcare professionals is not right. If a person is guilty of revealing the identity of individuals and targeting people on WhatsApp, it is in violation of WhatsApp policies. It can lead to a police case. Do not spread fear and panic. Do not label any community for the spread of COVID-19. We must remain united and care for each other instead of targeting communities. Everyone is wearing masks, gloves, using sanitizers, etc. to remain safe. If anybody catches the infection, do not target them. It's not their fault. Be compassionate. Cooperate with them and give them positivity. Tell them to avail treatment, take medications, and give them faith. Give them positivity. This will help them fight the infection. Social stigmatization affects patients negatively, which makes their recovery harder. There have been many cases, so give them positivity.